Usually when we talk about a really stubborn, nagging injury, like that tennis elbow that flares up every single time you pick up a grocery bag,
Yeah.
or, that Achilles strain that just refuses to let you run, there's this universal expectation that time heals all wounds.
Right. Yeah, you just rest, you ice it, you wait.
Exactly.
Yeah.
You wait, and then, you wait some more.
And for connective tissues, that waiting game can feel absolutely infinite because unlike a muscle belly, which is, completely flooded with oxygen-rich blood, tendons and ligaments are essentially, well, they're biological deserts.
Biological deserts, that's a great way to put it.
Yeah, they just simply don't have the blood supply required to shuttle in repair cells and flush out all the damage quickly.
Which is why it is so incredibly frustrating to be sidelined by one of these injuries. It drives people crazy. But what if the blueprint for accelerating that agonizingly slow healing process was, like, actually hiding inside your own stomach acid right now?
Yeah, it sounds crazy, but it's true.
So today, we are taking a deep dive into a compound that is at the absolute center of biological promise, massive underground internet hype, and, well, a very stringent regulatory reality. It's called BPC-157, or Body Protection Compound 157.
It really is arguably one of the most hotly debated, polarizing topics in regenerative medicine today. I mean, you have cutting-edge researchers fascinated by its potential, and then you've got desperate, injured athletes treating it like it's some kind of holy grail.
Right.
And they're all focused on this peptide because it seemingly targets those, this notoriously slow-healing biological deserts we just mentioned.
So whether you're an athlete looking for an edge, or maybe someone who is just utterly exhausted by chronic joint pain, or, just a curious learner who's fascinated by cutting-edge biology, this deep dive is going to give you the exact facts you need to understand this compound. We're building directly from a really comprehensive breakdown by Air Organics to sort of separate the confirmed laboratory science from the clinical unknowns. And honestly, we really need to start with the origin story, because it sounds like pure science fiction.
It really does.
So BPC-157 is a synthetic pentadecapeptide, which just means it's made up of a very specific sequence of 15 amino acids. But the sequence wasn't just invented in a vacuum, right?
No, not at all. What's fascinating here is that it's actually derived from a protective protein that is naturally found in human gastric juice.
Which is wild.
Right. I mean, our stomachs are incredibly harsh environments. They're basically filled with hydrochloric acid that's designed to break down really tough proteins.
Right, like a steak.
Exactly. So to prevent the stomach from, literally digesting itself, the body produces these protective compounds.
Yeah.
And BPC-157 is isolated from one of those native, highly resilient protective proteins.
Okay, I need you to walk me through this because I am completely lost on the mechanics here. How does something swimming in our stomach acid end up fixing, like, a blown-out knee or torn Achilles?
It's a fair question.
I mean, imagine my injured tendon is a collapsed building. What is this peptide actually doing at the cellular level?
Okay, let's use that collapsed building analogy. I'll
Yeah,
take that. So if your tendon is the collapsed building, BPC-157 acts as the general contractor, the plumber, and the traffic cop all simultaneously.
Oh, wow. Okay.
Let's look at the plumbing first, because that comes down to a process called angiogenesis. Remember how we said injured tendons are hypoxic, meaning they have almost no oxygen?
Yes, the whole biological desert thing.
Precisely. So BPC-157 attacks that desertification by upregulating something called vascular endothelial growth factor, or VEGF for short, alongside the nitric oxide signaling pathway.
Okay, VEGF. What does that actually do?
It's a signal protein. When the body releases it, it forces new capillary networks to actually sprout and grow directly into that damaged oxygen-starved tissue.
Wait, it's physically growing new blood vessels from scratch?
Well, it's initiating the sprouting of new vessels from existing ones.
Yes, that is insane.
It is. And at the exact same time, the nitric oxide pathway relaxes the smooth muscle in those vessel walls, which makes it easier for this new plumbing system to expand.
Oh, I see.
Yeah, so suddenly you have this huge rush of oxygen-rich blood and nutrients flooding into a hypoxic zone that just desperately needs them to sustain cellular repair.
Okay, so the plumbing is fixed, right? The construction site finally has oxygen and power. Now, what about the bricks? Because, whenever I get a deep cut or like a really severe sprain, the scar tissue that forms always feels, different.
Yeah, it does.
It feels stiff and kind of flimsy compared to the original tissue.
Yeah.
So does this just build more of that flimsy scar tissue?
That stiffness is actually a classic hallmark of poor tissue remodeling. And that brings us to the traffic cop and the general contractor functions of this peptide.
Okay, I'm tracking.
When you tear a tendon, your body just rushes to patch the hole with whatever it has on hand, right? It calls in these cells called fibroblasts, and they frantically lay down type 3 collagen.
And type 3 is the flimsy stuff.
Yeah, it's essentially disorganized, weak, early scar tissue. It's a biological Band-Aid. But BPC-157 dramatically changes this process. First, it increases the chemotactic movement of fibroblasts.
Meaning what exactly?
Meaning it chemically summons way more of them to the injury site, and it does it much faster. But more importantly, it accelerates the transition from that flimsy type 3 collagen directly over to type I collagen.
How much of a difference does that actually make, though, like for the actual strength of the tendon?
A massive difference. I mean, type I collagen is the heavy-duty, load-bearing structural protein. It makes up roughly 70 to 80% of a healthy tendon's dry weight.
Oh, wow. Okay, that's significant.
Very. But BPC-157 doesn't just dump a bunch of type I collagen into the area randomly. It also indirectly enhances an enzyme called lysyl oxidase.
Lysyl oxidase.
Right. And you can think of this enzyme as the mortar. It cross-links those type I collagen fibers together into a highly organized, mechanically stable matrix.
So instead of a messy jumble of stiff scar tissue, you're actually getting parallel organized fibers that can actually stretch and handle the stress of running or jumping.
Exactly. That is the mechanical promise, yes.
But okay, what about the immediate aftermath of an injury? Because if I tear a ligament, my immediate problem isn't just the structural integrity. It's that my joint is swollen to the size of a grapefruit and it hurts like crazy.
Right, the swelling is brutal.
Is the body just sort of fighting itself at that point?
It often is, yeah. Acute trauma triggers the release of these pro-inflammatory cytokines, specifically ones known as TNF-alpha and IL-6, and they're the ones that cause that massive, really painful swelling.
Okay.
And while, some inflammation is necessary to just signal an injury, the body frequently overreacts, and that causes collateral damage to the surrounding healthy tissue.
And BPC-157 stops that.
Well, it has been shown to reduce the expression of those specific cytokines. So it physically shortens the duration of the acute inflammatory phase.
Also gets it out of the way.
Right, allowing the body to stop fighting the swelling and get straight into that type I collagen remodeling phase much sooner.
Okay, I have to push back here for a second. Because you are painting a picture of a flawless, basically perfect biological healing machine.
I know it sounds that way.
I mean, it grows blood vessels, it organizes the strongest collagen, it shuts down runaway inflammation. If this is so miraculous, the results should speak for themselves, right? What actually happens when this is put to the test?
Okay, the data we have is incredibly compelling, but it comes with a boundary that we really have to establish very clearly. But let's look at the rat studies first.
Okay.
When researchers take rat models and physically sever their Achilles tendons, like a complete transection, and then they treat them with BPC-157, those tendons heal 30 to 50% faster than the control group receiving no treatment.
Wait, 50% faster?
Yeah.
That sounds entirely like science fiction.
I know. To put the timeline into perspective, a completely severed rat tendon that's treated with this peptide for just 14 days looks structurally and functionally similar to an untreated tendon at 21 to 28 days.
Oh my God.
It literally compresses the biological timeline, and the structural integrity improves at really crucial junctions too, like the enthesis.
Actually, I'm not familiar with that term. What is the enthesis?
Oh, it's the specific transitional zone where a flexible tendon anchors directly into hard bone.
Ah, okay.
And it is notoriously difficult to heal because you're dealing with two completely different tissue densities.
Yeah.
But in animal models of rotator cuff tears, BPC-157 treated tissues show a mature, beautifully organized fibrocartilage zone forming at that bone junction way earlier than usual.
That's incredible.
Under a microscope, the cellular organization consistently scores way higher than the untreated groups.
Okay, hold on. You're telling me we have a compound that heals severe structural damage 50% faster, creates perfect microscopic cell alignment, and it's just sitting there.
Yeah.
If this works so well, why hasn't a major medical institution funded the human trials to validate it? There has to be a massive catch that we aren't seeing here.
The catch is that exact boundary I mentioned a minute ago. You were hearing all these incredible outcomes, the perfect collagen alignment, the new blood vessels, but all of this robust data is entirely preclinical. Meaning there are absolutely zero approved human randomized controlled trials for BPC-157.
None at all.
Zero.
So we are literally looking at a canyon between these rodent miracles and actually validated human science?
A massive canyon. The biological mechanisms are beautifully mapped out in a petri dish and, in a rat's hind leg. But we simply do not have the clinical data to confirm that a human Achilles tendon or a human rotator cuff responds with that exact same 30 to 50% acceleration.
Okay, but biologically speaking, human beings and rats do share a lot of fundamental cellular pathways, right?
Yeah.
I mean, which is why we use them in trials to begin with. So, with human trials completely missing, how are desperate patients actually weighing this unproven peptide against the traditional treatments that their doctor, legally prescribes?
Well, you have to look at the reality of what the standard of care actually offers someone with chronic tendinopathy. And it is a very frustrating, very limited menu.
Let's run through that conventional lineup really quickly.
Yeah.
First, you have NSAIDs, your standard over-the-counter painkillers like ibuprofen.
Right.
They offer great fast pain relief. But they do absolutely nothing to physically repair the structural damage of the tendon.
Nothing at all.
And if you take them for months on end, you are risking severe gastrointestinal ulcers and, frankly, cardiovascular issues.
Yeah, it's a huge risk.
Then you have corticosteroid injections, which doctors just love to hand out.
They do. And corticosteroids are highly effective at suppressing inflammation and providing short-term symptom relief. I mean, you will feel better very quickly. But the biological irony is that repeated corticosteroid injections actually inhibit collagen synthesis.
Wait, really?
Yes. They can actually weaken the long-term structural integrity of the tendon. So you feel less pain, which means you go out and overwork a tendon that is now mechanically weaker than it was before you got the shot.
That is awful. And for a full rupture, I guess you're looking at surgery. A surgeon has to mechanically stitch the frayed tissue back together.
Right.
But the recovery for that is agonizing, anywhere from 3 to 12 months. And it carries the risks of anesthesia, hospital infections, and heavy, stiff scarring.
Exactly.
So when a patient looks at pills that wreck their stomach, shots that actually weaken their tendon, or a year-long surgical recovery,
yeah,
of course they start looking for alternatives.
It's completely understandable.
So how does BPC-157 stack up against the current darling of legal regenerative medicine? I'm talking about platelet-rich plasma, or PRP.
Oh, this is the heavyweight matchup in sports medicine discussions. So PRP is a completely legal, FDA-approved medical procedure. A doctor draws her own blood, spins it in a centrifuge to isolate and concentrate your platelets, and then they inject those platelets directly into your injured tendon. And those platelets are naturally packed with your own growth factors, including VEGF, which we talked about.
Because it's your own blood, the safety profile on that must be incredibly high, right? Your body isn't going to reject its own tissue.
The safety is excellent. However, the clinical evidence for PRP's actual effectiveness is surprisingly mixed.
Really?
Yeah. It works fairly well for lateral epicondylitis like tennis elbow, but it's way less predictable for Achilles or patellar tendons, and it is a major out-of-pocket expense. A patient is usually looking at $500 to $2,000 per injection session.
Wow. Now contrast that with the gray market for BPC-157. It is a synthetic peptide. You absolutely cannot get it at your doctor's office.
Yeah.
But online, a research-grade vial costs, what, between $30 and $80?
About that, yeah.
And while PRP relies on whatever concentration of growth factors just happen to be floating in your blood that specific day, the animal models suggest BPC-157 provides a highly targeted, arguably more potent cellular signal to drive that specific fibroblast response we talked about.
It creates the ultimate risk versus reward calculation for people. I mean, do you choose the safe, legal, expensive autologous treatment that has, moderate clinical results? Or do you choose the cheap, unapproved synthetic compound that turns rat tendons into structural steel but lacks any formal human testing?
And if you do choose to roll the dice on the peptide, we really have to talk about what happens to the rest of your body, because we've been focused entirely on localized repair, like injecting it right next to a torn Achilles.
Right.
This is a systemic compound. If I put this into my body, it doesn't just stay neatly quarantined in my ankle, does it?
Not at all. It circulates systemically. And the research into those systemic effects takes some very unexpected, fascinating turns.
When I was looking into the systemic benefits of this as a source material, my mind was absolutely blown. Because this compound originated in gastric juice, it is incredibly stable. Yeah. Even when it is taken orally, like swallowed as a capsule in doses of 250 to 500 micrograms a day, it actually survives the harsh environment of the human stomach.
Which is rare. Most peptides are incredibly fragile. If you swallow them, your stomach acid destroys the amino acid bonds instantly, rendering them completely useless. But BPC-157 literally evolved in that acid.
And once it is absorbed, it actively protects the gut. The animal models show it healing gastric ulcers and repairing the intestinal lining.
Yeah.
But the brain stuff is what really confuses me. The sources document that it acts on dopaminergic and serotonergic systems.
Yeah.
In standardized rat behavioral tests, it actually produced antidepressant-like effect.
It did, yeah.
How on earth does a tendon healer change my brain chemistry?
Well, it really comes down to the gut-brain axis and the fact that BPC-157 modulates foundational signaling pathways that operate everywhere in the body, not just in your joints. By interacting with the nitric oxide system and various growth hormone receptors, it exerts neuroprotective effects. It basically helps balance dopamine and serotonin expression in the central nervous system.
That's crazy.
In rats, it has even been shown to offer cellular protection against the neurotoxicity of certain drugs, and it even accelerates recovery from traumatic brain injuries.
It heals the gut, it fixes bones, it balances brain chemistry. I mean, it honestly sounds like magic.
Yeah, no.
But we know biology doesn't do magic. There is always a cost. We spent the first half of this deep dive praising how amazing this peptide is at building new blood vessel networks, right?
Yeah.
Isn't that exactly what cancer wants? I mean, if I have a tiny, undetected tumor somewhere, am I just pouring physiological fertilizer on it?
This raises an important question. That is the dark side of angiogenesis, and it is perhaps the single most critical theoretical safety concern surrounding BPC-157.
So it is a real fear.
Well, tumor angiogenesis is a recognized hallmark of cancer progression. Malignant tumors are often hypoxic. They desperately need new blood vessels to feed their runaway growth.
Right.
So if you introduce a systemic compound that acts as a potent trigger for new blood vessels, the theoretical concern is that you could inadvertently accelerate the growth of an undetected malignancy.
Okay, I want to make sure we get the nuance of this exactly right, because that is a terrifying prospect.
Yeah.
Have any published animal studies actually shown BPC-157 causing cancer or accelerating tumor growth?
No. In the published animal literature, there is zero documented evidence of BPC-157 causing tumor formation or accelerating malignant growth.
Okay, that's a relief. But why?
Well, the angiogenesis it promotes appears to be highly physiological, meaning it strictly responds to the localized chemical cues of wound healing. It does not appear to trigger pathological angiogenesis, which is that dysregulated, endless blood vessel growth that is associated with cancer.
So it isn't a known carcinogen. But the theoretical mechanism is so biologically plausible that it makes this peptide strictly contraindicated for anyone with a history of active malignancies.
Exactly. You simply do not want to introduce a potent blood vessel builder into a system that might be hiding cancer cells.
Makes total sense.
Furthermore, we have to consider the safety variable of time. The absolute longest animal studies on this compound only ran for 4 to 12 weeks.
That's nothing.
Right. We have zero peer-reviewed data on what happens when a mammal takes this continuously for 6 months, a year, or 5 years. The long-term safety profile of sustained BPC-157 use in humans is just a total mystery.
So given this wild mix of incredible biological promise, the completely missing human trials, and these theoretical cancer risks, what is the legal reality here? How are the authorities actually handling this?
The regulatory stance is very strict, and it actually recently became much tighter. BPC-157 is not FDA approved.
Okay.
It is not classified as a pharmaceutical drug, a biologic, or even a dietary supplement. In the United States, it is just illegal for human use.
But for a long time, there was a workaround, right? Because people were definitely getting this from actual doctors.
They were, yeah. Licensed compounding pharmacies could prepare it for clinical use if a doctor wrote a specific prescription.
Right.
But in 2022, the FDA made a massive regulatory shift. They explicitly removed BPC-157 from the bulk drug substances list.
And in plain English, that means under federal law, even a highly regulated licensed compounding pharmacy can no longer legally prepare this peptide for human administration.
Exactly. The FDA completely shut down the legal, medically supervised compounding channel.
Wow.
And if you are a competitive athlete who's subject to anti-doping regulations, the World Anti-Doping Agency, WADA, has strictly banned it, classifying it under peptide hormones and growth factors.
So the compounding pharmacies are out. WADA has banned it. The FDA says it's an unapproved drug.
Yep.
Yet if you go into any serious weightlifting gym today, or just search online, athletes and desperate patients are still getting their hands on it every single day. How is that possible?
It all happens through the research use only loophole.
Ah, the loophole.
Yeah, consumers can legally purchase BPC-157 online from chemical suppliers as long as the supplier labels the vials strictly for laboratory research and explicitly states it is not for human consumption.
It is a massive gray market. I mean, people are buying these tiny glass vials containing the peptide as a lyophilized powder, which is really just a fancy scientific term for freeze-dried.
Right.
And then they are basically playing amateur Walter White in their own kitchens.
Pretty much.
They buy bacteriostatic water separately. They have to carefully inject a very precise amount of that water into the vial to reconstitute the powder. They have to swirl it gently because apparently shaking it too aggressively can actually destroy the fragile peptide bonds.
Yep, it's a delicate process.
And then they just store this homemade, unregulated solution in their refrigerator, hoping it stays viable.
And that reconstitution process is where the legal and safety lines are completely crossed.
How so?
Well, the point of sale might be technically legal under the guise of research. But the moment a consumer draws that homemade solution into an insulin syringe and administers it to themselves, whether subcutaneously into their belly fat or intramuscularly near a torn tendon, they are violating the Federal Food, Drug, and Cosmetic Act.
Not to mention the terrifying physical risk they are taking with the product itself. I mean, when you buy from these unregulated research chemical websites, you are operating on pure blind trust.
Completely.
You are just hoping the powder isn't contaminated with heavy metals, that the amino acid sequence is actually what the label claims it is, and that the fragile peptide hasn't totally degraded while sitting in some hot shipping warehouse for 3 weeks.
It is a profound risk. But honestly, it just highlights the extreme desperation of the patients we talked about at the beginning of the show.
Yeah.
When someone has chronic Achilles tendinopathy that hasn't responded to 6 months of painful physical therapy, stomach-destroying NSAIDs, and tendon-weakening steroids, their risk tolerance shifts dramatically.
It really does.
Yeah.
I mean, BPC-157 represents the absolute cutting edge of biological frustration. On paper and in the bodies of laboratory rats, it makes perfect biological sense.
It does.
It is a compound that seems custom-built by nature to repair our most stubborn, poorly vascularized tissues. It summons the fibroblasts, it builds the structural type I collagen, it grows the necessary blood vessels, and it shuts down the runaway inflammation.
Yet, it remains entirely trapped in this regulatory and clinical gray zone. Because without controlled human clinical trials to establish standardized dosing, exact pharmacokinetic profiles, and definitive long-term safety data, it will remain an investigational chemical rather than a validated medicine.
It requires anyone looking at it to think incredibly critically about the balance of risk versus reward. Traditional medicine currently has a massive blind spot when it comes to effectively and rapidly healing connective tissue. And when the standard of care fails you, the underground science starts to look incredibly tempting, theoretical cancer risks and all.
It really serves as a powerful reminder that our understanding of biology is still rapidly evolving. And quite often, our regulatory frameworks struggle to keep pace with the raw, messy potential of what we are discovering in the lab.
Which leaves us with one final mind-expanding thought for you to ponder today. If a simple 15 amino acid sequence, derived from the harsh acidic environment of our own stomach juice, holds the power to fundamentally accelerate how our entire musculoskeletal system heals, what other miraculous regenerative blueprints might be hiding in plain sight right now, locked within the human body, just waiting to be discovered and synthesized? Thank you so much for joining us as we explored the biological promise in the muddy waters of BPC-157. Keep questioning, keep learning, and we'll see you on the next Deep Dive.